Why is no one talking about the fact that the guy who's the coach for the the Kansas City Chiefs is a dead ringer for Wilford Brimley? Why is no one talking about this?
This really bothers you.
It really upsets me. I feel like I can't be the only one who has noticed this. I mean, he's all over the television, and I'm like, I thought he was dead.
Welcome to Balls Deep, a humorous yet informative medical show with a mission of optimizing your performance in the bedroom, the bathroom, and the boardroom. I'm your host, Dr. Joe Pazona, a board-certified urologist and CEO of Pazona MD. We hope you enjoy. Now, let's jump right in. Hey, Stream Team, Dr. Joe Pazona here. We're back for another episode of Balls Deep, and as always, I am joined by Kat Williams.
I'm here.
Yes, you are.
I'm back. I'm ready.
Yeah, we are off of crutches. We are in a boot now for the foot.
I've been promoted to the boot.
Look at that sexy thing.
Wouldn't say that. No. But I'm doing better, yet still infirmed.
You're doing great.
Thanks.
You're doing great. We're T-minus maybe another week or two, and then back in some regular shoes. So
we'll see
crossed.
what happens. We'll see what happens.
Yes.
Fingers crossed.
I can't believe I'm saying this, but we are like 20-something episodes into this podcast, and we haven't talked about erectile dysfunction yet.
Bit strange.
Very, right?
Okay.
So
we should get to it.
Absolutely. So we're going to have episode 1 of a 3-part series on all things ED and penis. This will probably not be appropriate, but hopefully it's informative and we laugh a little bit. Yeah, absolutely.
Inappropriate in a good way.
Definitely.
Okay.
Well, let's, you ready to go deep?
Let's do it.
All right.
Balls deep.
Okay. First thing I think we need to talk about with erectile dysfunction is define it. What is erectile dysfunction? Doesn't sound great.
Yeah. So erectile dysfunction, or ED. So it's really a subjective definition in most cases, in that it's an erection that isn't as rigid or is more difficult to achieve than you're otherwise happy with. So it can be difficulty achieving and or maintaining an erection.
Or it's just not working.
In some cases, right, it's non-existent.
Okay.
Correct. Now, some things to know about sort of ED is that we also can do some like assessments, right? So in our practice, we like using a lot of surveys. It's a nice way to, just kind of gently ask some guys, hey, are you struggling with X? Even if they're here for other reasons, because believe it or not, erectile dysfunction, if you take a man's age in his decade, so let's say 60, by age 60, 60% of guys are going to have ED.
That's a pretty big percentage.
It is. And so obviously it's unfortunate that it's attached to this negative stigma. And let's first start off with that, right? Like, we're obviously here about educating people. We like having a bit of fun. We are by no means going to be making fun of anyone who's got ED. Every guy's going to get it, myself included. It's just going to happen. I mean, it's going to happen with time.
And this is probably not something people really feel comfortable talking about.
No, we've got to change that narrative, right? And I think that's, we've seen a lot about that with the pharmaceutical companies, and we'll kind of get into that in one of our upcoming episodes here where we do a deeper dive into the meds. But I think the first thing to realize is, first and foremost, ED is really common. And if you're having it, it doesn't mean there's anything wrong with you. Like
Okay.
This happens to manly men who are wildly attractive to their partner. It doesn't have much to do with that in a lot of cases. Now we'll talk about some special circumstances here. But yeah, so really when it comes down to it, ED, from what we care about as a physician, is, are you having difficulty maintaining or achieving an erection? And if the answer is yes, then you likely have ED and we can help. But we also do some validated surveys where we can actually kind of give you a score. The most common one is called a SHIM score, where we have a guy answer 5 questions and he answers it 1 to 5 with how good he's doing with different aspects of his erection. And now we can numerically score guys to get a sense for how bad it is. So we can get the idea of, well, is this just a guy who's yeah, I'm good most of the time. It's just not quite like when I was 20, or the guy who's like, honey, it ain't nothing happening down there for years. So there
Two
are
different
different
issues.
grades. Absolutely.
Okay. Well, start us off talking about then what are some causes of this? Other than age, other than, progression of age, which I think we probably all could common sense understand, but give us some other causes. What causes this?
So when we're evaluating patients with ED, we want to kind of first break it down into two big categories. So the first we'll call more psychosocial, behavioral sort of causes. Maybe things that are psychological,
Okay.
Situational. And then we have more what we'll call organic ED, which is the fancy doctor term for there's something going on with either the blood flow or your hormone levels that is anatomically preventing the erection, versus the former where it's like, well, you're really more causing this yourself, or there's certain situations where this comes up. So that's the first big distinction, is we'll call it psychological versus the organic causes.
Okay. Give us some organic causes.
Yeah. So if we look at what causes ED, I break it down into kind of two big categories. So about 80% of ED is due to blood flow issues. Okay. So if we look at the anatomy, the blood vessels going to the penis are about 1 millimeter in diameter.
That is small.
Very small. And that's why we also can't, quote, unclog them or open them up, because they're so darn small. You just can't clean out arteries that small. And then about 20% of it is due to hormone imbalance, namely, say, testosterone, where a guy has low T levels. And we've discussed that previously. Mm-hmm. So if we look at blood flow, what are the major causes of blood flow issues? Well, let's just look at everything that causes heart disease, because heart disease is the natural progression after ED. In fact,
Oh, really?
Yeah, absolutely.
Wow. Okay.
Because if we look at what causes ED, it's a blood flow issue. Well, what happens when the coronary arteries to the heart get clogged? You have a heart attack. When you have the carotid arteries going to your brain that get clogged, you have a stroke.
Yikes.
It's the same processes. So what are they? Smoking, obesity, high blood pressure, high cholesterol, diabetes, genetics. So all of the things that lead to heart disease, all the things your doctor is screening you for and tells you to worry about, it actually affects the penis first. And we say, to some degree, the penis is almost like the canary in the coal mine. Because once you start having ED, it is just a matter of time in a lot of cases to where now all of a sudden the arteries to the heart are going to get clogged.
So would you go so far as to say, I wouldn't have thought of this before, but again, I'm not a urologist. Is ED kind of, is it a marker of your health?
Absolutely. I mean, when I talk about a great measuring stick.
Yikes.
I mean,
inappropriate, but okay.
Very appropriate. I mean, I can't go through a day without saying something, whether I plan it or not, that doesn't have to have some sexual reference or something to the penis.
That's true.
So,
that's absolutely accurate.
Yeah. Well, welcome to my day. But no, in all seriousness, yeah, you're 100% right. I mean, it is a great marker, and it's a marker that has a function that we obviously all see as men, right? Like if your coronary arteries are getting blocked, they have to get pretty darn blocked before you're going to start getting chest pain. Just a little bit of narrowing of those arteries going to the penis is going to start causing some mild ED. So I think one big takeaway point for those who are listening is, if you're starting to have signs of erectile dysfunction and you haven't had a checkup, go get checked out. Because this may be your first sign, like, hey, listen, that extra 20, 30 pounds you're carrying, the cigarettes you haven't given up, that, blood sugar running a little bit high, something's bad's going to happen here in the near future. So you should really take that seriously. Okay.
So dialing all that back into a lot of episodes ago, we were talking about the 4 pillars of wellness. Mm-hmm. Clearly that's a part of this too.
Yeah, and I think we're going to cover that more in our upcoming episode here, where we're going to talk more about how do I treat ED. But yeah, absolutely.
But staying healthy, sleeping, good nutrition, exercise, staying healthy, works well for erectile dysfunction.
Yeah, I mean, listen, for all the women who are listening, you want a good reason to get your man to like take good care of his health.
This is a good reason. This is
I mean,
a good
seriously,
reason.
like it is, and it's not a matter of if, it's a matter of when. It's gonna happen if you ignore these sort of risk factors.
Okay,
So, yeah.
this is good information
Yeah.
for all of us. So you were talking about the organic causes, and then you also mentioned those psychological causes. Can you talk a little bit more about psychological causes of erectile dysfunction?
Yeah, this is a little harder one to kind of talk about with the patient, right? Because, you never want to tell a patient as a physician, this is, quote, in your head. Like when I hear that, it just, it makes me cringy, to steal a line from my teenage son, right? You're so cringe, Dad, or whatever, whatever the hell he says to me.
So cringe.
It's a real thing, and so let's just take one thing, stress. Okay. When we are stressed, we activate a part of our body's hormone system and our neurologic system that causes blood vessels to just kind of clamp down, that sort of flight or fight experience. So what's some real world scenarios? The guy who and his partner are struggling with fertility, and now sex is a chore, and the intimacy has been removed. And now he starts having some trouble with erections. And of course, the wife now thinks it's because she's not attractive, and that further stresses him out and leads to this discord. And now all of a sudden he's seeing me. That's a real life scenario where that's not in the guy's head. I mean, it's legitimately happening, but there's physiologic reasons behind it.
So stress can be completely the factor of erectile dysfunction. It could be.
Absolutely. Another thing we see is, and this is sometimes cultural, sometimes generational. There are a lot of young adults who come into their first encounters of intimacy and sexual experiences with a lot of, I hate to use the term baggage, but a lot of things from their past that really shape how they think about sex. Imagine growing up in, I was raised Catholic, a very Catholic home where it's like, masturbation's for the devil, that sort of thing.
Right.
And you carry that with you. All of a sudden it's like, that's going to affect you in the bedroom. Right. Or we notice also, I see it in people who are saving themselves for marriage, which again, totally respect your decision. But imagine how much pressure you're putting on yourself if your first episode of intimacy with a partner, you're now in your mid to late 20s, and it's like, all right, perform. Like you've been waiting for that moment for how long now? So a lot of those things play a big role. One of the more interesting ones that I think is worth discussing is actually porn.
Oh, wow. This is about to jump the ship.
No,
Porn.
no, I'm actually
porn. We've already made it to porn.
Believe it or not, I'm going to actually keep this very appropriate.
It's a Tuesday.
Don't worry.
Okay.
No, I'm going to keep this very appropriate. Obviously now we live in a world where porn is just, you just dial it up on your phone,
everywhere.
right? I mean, you don't have to sneak into your dad's closet late at night and see whether or not he'd left his 1976 Playboy or something.
I don't know who your dad was. Okay, wow.
Or who I was.
Or who you were, yes.
So, you think about sort of, again, that sort of that psychology and that sort of stress, there's some pretty vile things that are on the internet when it comes to sexual experiences that those of us who have had, I think, of children of the 90s when we were coming into our sort of sexual introduction, right? It's just like you just kind of fumbled around with a partner and that's all you knew. Well, imagine now you're someone who you're with your first partner and you've been watching the stuff that's out there on the internet. You're going to think what's on the internet is normal. And so some of it is almost a desensitization. I mean, there was a very amusing South Park episode about this actually, where I think the internet went down and Stan's dad had to go find his internet connection because without watching this vile porn, he couldn't orgasm. And so, I mean,
this is what you're doing at night, watching these.
Well, this is a great episode.
Okay.
It illustrates it illustrates the point.
Okay.
For those of you who haven't seen it, look it up. It's a hilarious episode. But the point being, he's talking about all right, now I got to search for blah, blah, blah. And you're like, oh my God, is that something? So the whole point being, if your brain, because our brain is our biggest sex organ, okay, if our brain as a man especially is programmed to think, I've got to see this following list of crazy things in order for me to get an erection or reach orgasm, how boring is it when you're now fumbling through sex with some partner who it's their first time and you guys are kind of awkwardly kissing and snuggling and you're like, wait a minute, this isn't what I'm used to.
Right.
So there truly is something called porn-induced ED that is sort of a really new phenomenon that's come out recently. So, the public service announcement is don't watch so much porn. I mean, that really it does have effects here that are going to affect your intimacy, amongst all the other your thoughts you may have about the industry.
So take a break from porn. Okay.
Yeah.
Good takeaway from the day. Okay. Tell us anything else, other causes of ED that we haven't touched on that people would be interested in knowing.
Yeah, absolutely. I think we can go through a couple here. So we touched briefly about testosterone. So I use about an 80-20 rule. I believe about 80% of ED is due to the blood flow. But a 20% is we do need testosterone. Testosterone drives our libido or interest in sex. So sometimes guys coming in, they think they've got ED, but the issue is they just have no interest in sex whatsoever. So the penis works fine. The blood vessels work fine. They just have no hormones to cause the drive. And again, if our brain is our biggest sex organ and you're not turned on, any one of us who've been tired, had a rough day at work, it's like, well, it takes a little bit more effort to kind of get things going down there. And so, that's a big one. And we do a really good job with our practice of screening guys for low T. And then there's a whole category of things that we as surgeons or physicians, we cause the ED. So we look at treatments for prostate cancer. A lot of men who've had their prostate removed or radiation, that can lead to ED. We look at various medications. High blood pressure medicines are the classic one. Now, it's a little bit of a chicken and the egg. Did the high blood pressure cause the blood vessel damage that led to the ED? Or was it the high blood pressure medicine that led to the ED? So we don't always know, but nonetheless, there are absolutely some medicines that cause trouble with erections and sexual performance. So those are some other kind of big ticket items that lead to it. But ultimately, that's why we're here as board certified urologists. I think that these online pharmacies, for lack of a better term, of what these new businesses are, these quote telehealth companies that like get your blue pill in the little pack and we'll mail it to your house. I think that's great, right? Guys now have easier access to these medications that we'll dive into here in a little bit, but they don't talk about the root cause, right? They don't work up these gentlemen for what really is causing it. And we're going to dive in here real soon into what are some things we can do to maybe reverse that ED. And so it's so important to really partner with a board certified urologist who looks at searching for those root causes of these illnesses, because you can't optimize your performance in the bedroom if all you're doing is using Band-Aids. And sadly, the pills will eventually stop working if we don't start reversing some of those diseases and work on your weight and your diabetes and all those things. So I think that's one of the last points to make is that, partner with the right men's health expert and we can start reversing some of this. And maybe you can be in that 10% of guys in their 90s who are like, still going with that diamond cutter into the bedroom.
Oh my God. And then some people just want to watch Netflix. So that has been an excellent, talk about causes of ED. I learned several things. Let me give our final takeaways in my favorite part of the show. Just the tip. So number one, erectile dysfunction is very common. This happens to probably most men at some point in time, and you shouldn't be ashamed of that. And it affects 60% of men by age 60.
Yep. And every decade it goes up another 10%. So 70% by age 70, 80% by age 80.
Wow. Okay, number two, most cases of ED are caused by poor blood flow. And number three, the same medical conditions that cause heart disease can lead to erectile dysfunction, things like high blood pressure and diabetes. So watching your health also works for working on erectile dysfunction.
Yeah. And I mean, that's why, that's one of the reasons Pazona MD exists. We talk about optimizing performance in the bedroom, the bathroom, and the boardroom. And you can't optimize performance in the bedroom if we don't look at the underlying root causes and really focus on those 4 pillars of wellness, which we're gonna dive into.
We'll talk about that next.
I just want to, more than anything, we've got to start normalizing these conversations. There are so many guys who come in and go, "Oh, my partner's convinced that I don't find them attractive." And that's really the rare case. Now, occasionally we do get those like, I got to be honest. I mean, I'm having some attractiveness issues with my partner. And I was like,
can't help you there.
All right, bro. That's a conversation I'm not getting involved with. Be very careful I'm talking to you now as a spouse and as a husband. Be very careful and tread lightly.
Choose your words carefully.
How you handle that one. But it's very complex. I mean, it really is. It's not always just as simple as here's your blue pill and off you go. I mean, we didn't talk, maybe we'll talk about in our next episode. I mean, sex therapy is sometimes is something that's going to be really helpful to help you with this ultimately. But we got to at least first bring awareness, right? We want to bring awareness that this is common and you shouldn't feel ashamed. Most guys have it. And if they don't, they're either lying or it's just a matter of time. So,
okay.
Awesome.
Thanks for the chat.
We were pretty PG for this, I got to say. I mean, minus a couple little comments here. We're pretty good.
I was trying to be really cool.
Well, we got 2 more episodes here, so
it may not last.
It'll probably deteriorate.
Stay tuned.
Honest. So, well, Stream Team, thank you for joining us for part 1 of our ED talk. We really appreciate the engagement. We're seeing more of you viewing us on YouTube. We'd love to hear from you. Give us ideas for future podcasts, and just have some fun. Spread this with some friends. We're in the world of edutainment. We want to make something educational but entertaining as well. There's enough dry doctor shows out there, and there's also enough misinformation that you want to hear from an expert. So, as always, please show yourself a little bit more love and grace. Setbacks are always opportunities to improve. Thanks, and have an awesome day.
Thank you for listening to this week's episode of Balls Deep. If you'd like to join our Stream team of listeners, please click the subscribe button on your favorite podcast platform. For more information about our practice, Pazona MD, please visit pazonamd.com. This podcast is for informational purposes only, and the content is not intended to be a substitute for professional medical advice. The show does not constitute the practice of medicine. No doctor-patient relationship is formed through this podcast or any of the social media channels related to this show. The use of this information is at the user's own risk. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.